Hello, greetings. So let's talk about nephrectomy in surgery with Miss and Miss Nanamba. Mr. Zimba, a 60-year-old man, is admitted to male surgical ward with complaints of frank hematuria, low in pain, and the feeling of a renal mass. After investigations, a diagnosis of renal stones is made and is scheduled for elective nephrectomy. Question A, define nephrectomy. 5%. Question B, state 5 indications of nephrectomy. 10%. Question C, state 4 types of nephrectomy. 10%. Question D, describe the post-operative management you would provide to Mr. Zimba. 50%. The last question was saying, explain 5 complications that may arise following nephrectomy. 20%. So let's start with the definition of nephrectomy. How do we define nephrectomy? Okay, in my definition, I'm saying nephrectomy, basically, this is nothing but the surgical removal of the kidney performed to treat a number of kidney diseases such as cancer of the kidney or maybe chronic renal failure. Yes, that's the definition of nephrectomy. So one thing that you need to take note, it is for the fact that whenever you're defining a procedure, you are not expected to talk about the characteristics. Just talk about some indications, at least 2 or 3 indications. The second question was asking us to state 5 indications of nephrectomy. Yes, it was asking us to state 5 indications of nephrectomy. So we have quite a number of indications. The first one is tumors of the kidney. Yes, benign tumors of the kidney. The second one, chronic infections of the kidney, such as chronic renal failure or simply chronic pyelonephritis. The third indication, kidney transplant. Yes, kidney transplant. The fourth indication, polycystic kidneys. Yes. Then the last indication is, I could talk about cancer of the kidney. Yes, malignant cancer of the kidney. So these are the indications of nephrectomy. Question C, state 4 types of nephrectomy. State 4 types of nephrectomy. Marks are located 10%. So what are the 4 types of nephrectomy? So the first type of nephrectomy is partial nephrectomy. So this type of nephrectomy, it is sometimes referred to as semi-nephrectomy. Yes. So this type of nephrectomy, basically, it involves removal of the portion of the kidney that is infected or that is diseased. Yes. So in partial nephrectomy, we just remove a portion of the kidney that is infected. The second type of nephrectomy is simple nephrectomy. So in simple nephrectomy, here they remove the entire kidney. Yes, they remove the entire kidney. In most cases, this procedure is performed for the purpose of kidney transplant. Yes, this one, it is performed for kidney transplant purposes. The third type of nephrectomy is radical nephrectomy. So for radical nephrectomy, here they remove the entire kidney, including nearby structures. Structures such as the adrenal gland, the fatty tissues, and also the lymph nodes are removed at the same time. That is radical nephrectomy. Mainly this procedure is performed when there is malignant cancer of the kidney. Yes. Then the last type is bilateral nephrectomy. Yes, bilateral nephrectomy. So for bilateral nephrectomy, here they remove both kidneys at the same time. Yes, they remove both kidneys at the same time. That's what? Bilateral nephrectomy. So these are the 4 types of what? Nephrectomy. The fourth question, which was question D, it was asking us to describe the post-operative management would provide what to Mr. Zimba. The marks are allocated 50%. Okay. So remember in my previous video I talked about what? The post-operative management. So please you can watch that video for more details on the post-operative management. Yes. Then the last question was saying explain 5 complications that may arise following what? Nephrectomy. Okay. So the first complication is what? Is urinary tract infections. That's the first complication. The second complication is failure of the what? Of the opposite kidney. Yes, failure of the opposite kidney. The other kidney may fail once the other kidney has been what? Removed. Yes. Then we could also talk about anemia. So we all know to say the kidney it produces erythropoietin, a hormone that is essential in what? In red blood cell production. So once the kidney has been removed, that basically means to say the person will be prone to what? To anemia. Yes. We can also talk about wound gapping. Yes. The incision site may easily do what? Separate. We can also talk about pneumonia. So pneumonia, this one may come in due to what? Prolonged what? Breathing. So it is very important once the patient is coming from theater, teach the patient about what? Deep breathing what? Exercises to prevent anemia. Yes. Then finally I could talk about wound infections. Yes, the wound may be infected due to what? Aseptic techniques during what? Wound care. Yes, so those are the complications of nephrectomy.